So the immediate management depends on how severe the hypocalcemia is and if there are severe symptoms or not. There is no consensus or guideline currently to guide this treatment, but we recommend that symptomatic hypocalcemia, especially when there are symptoms such as carpal or pedal spasms or even seizures or laryngospasm, there needs to be IV treatment, rapid IV treatment with 200 to 300 milligrams of elemental calcium. By slow intravenous injection. You should have patients under cardiac monitoring if possible, and you should not give this calcium at once in a shot because that can cause problems. So you need to be rapid, but not too rapid, and control calcium and symptoms over the next hours. This initial bolus dose of calcium should be followed up by intravenous infusion over the next hours of, for example, 10% calcium gluconate, and we recommend 0.5 to 3 milligrams per kilo per hour in the next hours. So dissolved in a 5% glucose infusion. In milder cases, when the symptoms are not so severe, it's possible to treat with just oral calcium and active vitamin D analogs and control patients over the next days. So it very much depends on the degree of symptoms and the degree of hypocalcemia, and also the severity of all this together and the speed which with that came. So the conventional treatment of chronic hypoparathyroidism consists of vitamin D, active vitamin D, usually also native vitamin D, and calcium supplements in case when the calcium intake with nutrition is not sufficient. So depending on the country where you live, these might be different types of active vitamin D. So usually it's either calcitriol or alpha calcidol in doses of 0.25 up to 2 or even 3 micrograms per day in divided doses. So usually it's okay with 2 doses, sometimes 3 doses are necessary, because the half-life of active vitamin D is relatively short in just a few hours. For calcium intake, it really depends on the nutrition a person has. So if calcium intake is okay, so above 1,000 milligrams or more, the calcium supplements are not necessary in some patients. In many patients, calcium supplements, however, are necessary, usually also in divided doses, depending on the nutrition as well. So we recommend calcium carbonate or either calcium citrate, depending on if you take, for example, proton pump inhibitors. There, if it's available, calcium citrate is usually better resorbed. Sorry. And an additional advantage of calcium supplements is also that calcium can act as a phosphate binder when taken with meals. What is also important and sometimes not done enough is to ensure that an active native vitamin D concentration is present. So we recommend at least 20 nanograms per ml or 50 nanomole per liter of vitamin D levels, so 25 hydroxyvitamin D, and to be able to ensure that usually a dose of more than 800 units per day is necessary. Sometimes, depending on the patient, especially for patients who are under treatment with hypopara replacement therapy with parathyroid hormone, sometimes much higher doses are necessary, but you can control this with a vitamin D level very easily. And that should be taken at least once a year. So the conventional treatment is the more often prescribed treatment. In cases of illness, this dose sometimes needs to be adapted. So it depends on, again, the degree of severity of illness. Sometimes, depending on the calcium concentration, that needs to be checked if people are feeling unwell, because it can go either direction. So we're always facing this balance of too much treatment and too little treatment. So when patients are not feeling well, it's always wise to take a calcium concentration. Sometimes even in chronic hypoparathyroidism management, a round of IV calcium can be necessary, especially when, for example, diarrhea or gastrointestinal infection is present. So in some patients, also on-demand calcium supplements are necessary, for example, for physical activity, for traveling, for going hiking, for example, if you're on a few hours physical activity. For some patients, additional calcium, sometimes also magnesium, is necessary. And also people should carry calcium supplements that can be taken with them all the time for a case of hypocalcemia, when they're feeling symptoms of tetany or paresthesia. So typical symptoms of hypocalcemia can be treated with calcium supplements on demand also.